Hello, I'm Raj Gupta from Vanderbilt University in Nashville, Tennessee. We're going to do a little demonstration today of how the Apple Vision Pro could be used as an instructional tool for regional anesthesia, particularly with the ultrasound. One of the challenges with ultrasound guided regional anesthesia is the screen is often distant and removed from where our hands are. And so my hope is to demonstrate that we can bring the ultrasound image close to us to have a more ergonomic approach to doing the regional anesthesia, and maybe a little extra with that as well. Okay, so first off, we're going to get the Vision Pro hooked up, and you'll be seeing what I'm seeing through the headset. And the nice thing is I have still clear view of my patient and the surroundings in the area. Now, first thing I'm going to do is get the laptop connected. So I'm using the laptop as a way of bringing the ultrasound image into the Vision Pro. And we see it a nice big screen here. And I can grab this and bring it close to me wherever I want. So whatever's convenient, I can bring it right here. And I've got a nice big clear screen to work with. I can also resize it if it's too big. I can make it smaller, bring it closer or further, depending on what's the most convenient relative to the environment I'm working in. So let's see how this looks. The other nice thing is we found out that even with gloves on, I can still see what I'm doing and still control the Vision Pro. So we'll put a little bit of jelly on Brian here, our volunteer for his inner scaling groove, and we'll take a look with the ultrasound. Now the ultrasound is way over there. I'm not even looking at it. And I've got a nice big view here. And let's say I want to bring that a little bit closer. I can just grab it and bring it right where I want. Oh yeah, that's really nice. And so I can take a look, vessels, see our brachial plexus, and we can get a view of the inner scaling. If I feel like it's too close, uncomfortably close, I can just push it back, grab it, move it over here maybe. I want to get a more ergonomic view, and I can see that. Now let's say I want to bring it really close to where I'm working. I can bring it right here next to me and literally have a view directly in front of me with my hands in view as well. Now it's occluding a little bit because of the way the overlap is, but there's always a few other adjustments we can do to make that workable. So real easy to do, even with gloves on, even without having to touch anything extra. Now I've got this viewpoint. Let's see if we can add some more information to this. I'm going to put this down for a moment, and I've got some information on a browser that I can bring in here. So this is from the azure.com website. I have some instructional material. I can scroll up to look at this cadaveric dissection. There's a nice diagram, some more information, but I really like this little line diagram just to remind me where all the nerves are. Let's say I want another piece of anatomical information. I'll go to an iPhone app that I've had for a long time that gives me 3D anatomy. So I've got this 3D anatomy, and I can move this around to the view that I want. Well, I'm looking at Brian's left side, so let's line up the left side. So I've now got two pieces of information. Oh, and I forgot to check Brian's on Plavix. I don't remember what I have to do for Plavix. So let's open up our Coags app and restart and go back, and we'll begin. And we'll type Plavix. And we'll see what the recommendations are for Plavix. Great. So I'm good to go. He's been holding it for about 7 days, so we're good to go. We've got our diagram here. We've got our anatomy. That's great. Now I can go back to my ultrasound image all in one view. I've got everything I need to get a full assessment. And even with my other hand, I can still control things and make it work. So this is just a quick demonstration of what might be possible as we're teaching and learning how to do ultrasound guided regional anesthesia. Thank you, and hope to get some ideas from you. If you have some ideas you want me to try out, let me know. Thanks.